According to statistics given by the Centers for Disease Control and Prevention, the highly contagious Omicron BA.2 subvariant XBB.1.5 is now responsible for more than 40% of the most recent COVID-19 cases in the United States. Despite the rising number of COVID cases in China, which is an infectious disease, many public health specialists are also worried about the doubling superversion XBB.1.5, according to Reuters. Ironically, probably the worst variant that the world is facing right now is actually the XBB, said Dr. Michael Osterholm, an infectious disease expert at the University of Minnesota, in a recent interview with Reuters. Now, what is XBB 1.5? In addition, Osterholm noted that the Northeast is home to 7 of the 10 US states with the highest rate of hospitalizations and cases, which is also the region with the highest rate of XBB cases. For the week ending December the 31st, XBB and XBB.1.5, two recombinants of BA.2 variation jointly accounted for 44.1% of all cases in the nation. For the week ending December the 24th, XBB.1.5 accounted for 21.7% of all cases. In August, XBB was found for the first time in India. Therein and Singapore, it swiftly grew in power. A number of subvariants, including XBB.1 and XBB.1.5, have been developed from it. According to Johns Hopkins University virologist Andrew Beck's, XBB.1.5 differs from other members of its family because of an extra mutation that improves its ability to connect to cells. The virus needs to bind tightly to cells to be more efficient at getting in, and that could help the virus be a little bit more efficient at infecting people, Pecos says. Now, why is XBB.1.5 highly infectious? Immunologist Richard Cow, a scientist and assistant professor at Peking University, published data on Twitter Tuesday that indicated XBB.1.5 not only evades protective antibodies as effectively as the XBB.1 variant, which was highly immune evasive but also is better at binding to cells through a key receptor. Scientists at Columbia University have warned that the rise of subvariants such as XBB could further compromise the efficiency of current COVID vaccines and result in a surge of breakthrough infections as well as reinfections. The XBB variants are also resistant to Evusheld, an antibody cocktail that many people with weak immune system rely on for protection against COVID because they don't mount a strong response to the vaccines. The scientists described the resistance of XBB subvariants to antibodies from vaccination and infection as alarming. The XBB subvariants were even more effective at dodging protection from the Omicron boosters than the BQ subvariants.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.